Welcome back, everyone. I'm Steve Brunton, and we're talking about how to understand COVID-19 from the perspective of control theory. Today, I'm going to zoom into some control strategies and just how to think of control design when suppressing or dealing with an infectious disease. Okay, so this is our overarching control diagram. We have our disease system over here. It's unstable. Infections grow exponentially when they enter a population. And our goal is through some control actions to suppress this rate of infections to bring it below the healthcare capacity, okay? And at the same time, there's some other objective functions that I think are really important. So that's one primary objective is to save lives. There are also livelihoods at stake here. So we want to do this in a way that is not destructive to the economy or as minimally destructive as possible. Okay, so this is a really, really hard control problem, a really hard optimization problem. And so you've heard me say this before, and I'm going to say this again. Control design, building a controller, is essentially an applied optimization where you're trying to achieve some goal given the constraints of the real world, of the dynamical system that you're given. In this case, this unstable infectious disease. Okay, and so later, we'll talk about how to actually design that cost function and what are some of the things that go into it. But today, I'm really going to zoom into the controller itself. What are some control strategies? What are some of the challenges for this particular system, like time delays, limited measurements, imperfect models, instability, things like that. So we're going to get into the texture of how and why this is a challenging control problem, but also why control theory is an essential perspective when we're talking about flattening the curve, when we're talking about making a plan to bring people back into the workforce. You know, control theory, this is at its heart a control problem, whether we call it a control problem or not. And so I want everyone to be thinking about the control theory aspects of this. Okay, good. There's a really interesting IEEE Spectrum article on how to control COVID-19. And so I'm just going to walk you through kind of some of the highlights of this paper. So you should go check this out. You can download this online for free. So these authors essentially are talking about how can we control COVID-19 and how can we get people, how can we do this in a way that's minimally invasive or destructive, okay? And so one of the big concerns is that, we've ramped up this global effort to suppress this runaway exponential growth of COVID-19. And I think this has been a really heroic effort on the parts of many, many people, governments, countries all across the world. People have really jumped into action to lower the rate of infections so that we don't overwhelm the healthcare system, so that we can save lives. And there's a lot of discussion now, so hopefully we're nearing or past the hump in many places of that kind of initial peak. But the goal now is to try to start thinking about how do we start to turn our economy back on? How do we start bringing people back to work, back to school? And so I think this is a really important perspective and article is, so in this case, they're assuming that they can control that R0 reproduction number. That's related to the rate of spread of infectious disease in the SIR model. And so one of the fears is that if we stop this intervention, if we stop all of these social distancing protocols and we bring people back and we just go back to business as usual, people are afraid that this is going to cause a rebound and another period of exponential growth, and we're just going to have to go through this lockdown all again, okay? And people want to avoid that, obviously. And so, one strategy is kind of an on-off approach to phase, on and off these different aggressive control strategies of social distancing and limiting conferences and concerts and large gatherings, things like that. Another strategy would be to phase in kind of like a rolling work week, maybe a 2-day work week where different people stagger it so that you can keep this R0 low. Lots of different strategies. These authors argue that one of the most effective strategies is feedback control. Okay, so actually taking measurements of your system and how that system is growing and the number of patients needing beds, the number of people sick and dying at any given moment, and using the actual data of the system to feed back to design kind of an optimal intervention strategy. So it's not just bang, bang, on and off, kill the spread, then open everything up and wait for it to rebound, then kill the spread, then open everything up and wait for it to rebound. So this is a more subtle or nuanced approach where you phase in kind of a more subtle control strategy based on measurements of your system and feedback control. I think this is a really cool idea. And I think it's a perspective all of us need to be thinking about is how can you actually use what we know about control theory to get a better response and a better recovery. Okay. Now, a couple of challenges I want to point out that make this very challenging are time delays. That's one of them, is that it's very hard to do this if there is a delay of 1 week between when you enact a control strategy and when it becomes effective, or if there's a delay in 1 week between when someone gets an infection and when their symptoms show. So time delays really make it hard to do this feedback process robustly and responsively, kind of to be agile and robust. And I'm going to talk about that in a little bit. Okay. And so they run some cool scenarios. So kind of at different reproduction numbers. So this might differ by city. It might differ by country, by population. They can kind of get these different responses. Okay. So I think it's a very interesting perspective that we should be thinking about feedback control and all of the tools of control theory to bring to bear on this problem. Okay. And that's something I want to point out is that, control theory is the theory of how to make these hard optimization trade-offs, how to control a system, how to change the behavior of a system that might be unstable and really messy, even when we have imperfect models, even when we have imperfect measurements. That is what control theory does. And so, that is absolutely the perspective we need to be taking, both as individuals and, at a policy level. We need to bring control theory into this discussion. Okay. So, the control knobs are pretty difficult. So I want to think about, so one of the other challenges of doing that feedback control that's more subtle is that at the current moment, a lot of our control strategies, at least in the US, are very kind of blunt, to be frank. So, city by city or state by state, there are these large decisions, close shops, close restaurants, limit gatherings, close the parks, close schools. These are big control knobs that affect everybody in some group, in some city or state, okay? And if you want to have a more subtle response, a more subtle control action, we're going to need more control authority. We're going to need to zoom into smaller pockets of society and make more nuanced control decisions. And that's really hard. So it's hard for a number of reasons. It requires a lot more measurements and more sophisticated models. It also requires a lot more intervention. And in general, people don't necessarily feel that comfortable about being singled out for control, actions. But that's one of the subtleties and difficulties of this problem is that, the system itself involves millions and billions of people, and we are the dynamical system, we are the controller, and it's our actions that matter. So, a little bit finer granularity is important. Good. There's other issues with the controller itself. There are limits to our control authority. Okay, so I'm just going to put up some of the issues here. There's limits on how much control authority we have. Presumably we can't tell every individual person exactly what to do at every moment of their day. When to go to the grocery store, when to go into work, when to cough, when to sneeze. Right? You can't control every action of every person. So there's limits on control authority. Also, we can discourage handshakes, but you can't make negative handshakes. So there's limits to what we can do. We can shut down lots of businesses, but presumably we still need farms and supply chains and grocery stores and hospitals and police and firefighters. We still need essential services. And so there's limits on what we can control. And we've already talked about the massive time delays in the system, the uncertainty of the model, not uncertain model, but uncertain model, and the fact that this model is changing over time. Every day, the model changes. If it's sunny outside, people act differently, right? The whole model is constantly changing. And so one of the strategies I'm going to talk about that's really good for that kind of scenario is model predictive control, okay? And I'm going to zoom into model predictive control now in this lecture. All right, so the basic idea is, especially when we have limited measurements and time delays and we don't trust our model that much, we have a model, but we don't think it's that great. So in my video on models, you just saw how all of these models kind of disagree. So we have models, but they're uncertain. In that scenario, kind of one of the best strategies we have is to use a model-based controller to kind of forecast where we think the system will be under different control actions and pick the best one that we think will be most effective. But because our model is imperfect and our controller is imperfect and this whole system is uncertain, you're going to measure the system and see how effective it actually was. And on a slower timescale, you're going to kind of supervise and correct those control strategies. So I think of this as a kind of supervisory slow feedback controller based on measurements. But to get responsive action, you need to make fast decisions based on models when you have time delays. And so I'm going to lump this all into a model predictive controller, and I'm going to tell you how this works. So this is one of many strategies that we use for controlling complex systems. And I will point out that model predictive control is used all over industry. It's one of the most industrially relevant control strategies when you have a complex system with all of these challenges. When there's uncertainty, when your model's not perfect, when there's limits on the control, time delays, a lot of times you're going to use model predictive control. Good. So the basic idea of model predictive control, and I'm going to zoom in a minute, is that, let's say that we're at this point in time where we have this yellow dot. So we've noticed exponential growth. We're freaking out. We don't want it to, the system to blow up. And so what we're going to do is decide on some control action to take. And this is going to be a massive oversimplification of MPC. This is a huge field. Tons of people work on this. It's a really sophisticated field of control theory. But in my cartoon version, at this time, what you're going to do is you're going to forecast lots of different control actions, what they do in the system, and you're going to choose one of those controllers. Okay? So this is fundamentally based on a model of what your system will do in the future. In this example I'm going to show you, I'm going to use this simple SIR model that I talked about in the modeling lecture. This is one of the oldest and most classical dynamical systems models of infectious disease. This has been around since the 1920s. And in this SIR model, you can see this rate of infections increasing and then decreasing as it essentially goes through the population and everybody becomes infected. And that's what we want to prevent. We want to prevent this just exponentially growing until everyone in the population is infected and then dying out. Okay, and so specifically what we're going to do is control this infection rate, this beta that tells me how fast people become infected. And one way we can do this in this analogy, so this is a great article by Harry Stevens in the Washington Post, where essentially we can in fact control these transmission factors by things like shelter in place or rigorous hand washing protocols or requiring face masks, limiting large gatherings, things like that. So we're going to control this beta parameter. It's going to be costly. That's something important, is that this is not free. This is going to have a tremendous societal and economic impact to control this beta, but that's our control knob to try to suppress the growth of this disease. Okay? Good. So I'm going to walk you through a cartoon. I actually ran these simulations using that SIR model. So this is based on real dynamical systems data. Now, of course, all of the numbers I'm using, I just cooked up to make the point. But this is actually a real model. So we have our rate of infections. If unchecked, if there's no control, then our rate of infections will grow massively, and it'll peak above the healthcare capacity, and that'll be a big problem. So what we're going to do is at some point we realize the system's unstable. We know we're in trouble, and we're going to make some control decision. So, and this is a cartoon, okay? So I'm assuming that there are kind of 3 decisions I can make. I can do low, medium, or aggressive, kind of low, medium, or high degrees of control. So this is, not very much control, a medium amount of control, and then very, very aggressive control. And I'm also assuming that I'm going to have them at different lengths of time, but that's something you would also optimize over, okay? And each of these controls is more costly than the last. So the, purple control is more expensive than this one, and that's more expensive than this one. So I only want to bring out the big guns if I really need to, because it's going to have a huge kind of economic and societal toll. And that's going to go into this optimization cost function. So MPC is essentially going to run this forecast of all of these different control scenarios. And it's going to try to optimize and pick the best control law that optimizes some cost function given what it thinks the future model is going to do. And in this case, it looks like maybe I should pick this middle effectiveness control, not the least effective, not the most effective, because that's the one that just barely gets me under this curve at the lowest cost. Okay, so let's choose that control law. And now what we do is we actually enact that control law and see what happens. This is a critical step in model predictive control, is that you actually enact that control law and you measure what the system does after some time has passed. Now in this case, I made it so that, remember, our model is not perfect. Our control actions are not perfect. And so what the system actually did is a little different than what we thought it was going to do from the model. So in this case, it was a little worse, but not a ton worse. It's not as bad as doing nothing. So now you repeat the whole process over again. So now we take those 3 control actions, or however many control, whatever control you're optimizing over, we forecast those control scenarios, and now we pick out of those controllers, what's the one that does the best job at the goal I'm trying to optimize. In this case, trying to stay under the healthcare capacity as inexpensively as possible. Now, you might want to pick that middle controller again, but I know at this point that my control law, was a little bit less effective than I thought, and so maybe I'm going to go for the more aggressive control law in this situation. Okay, so now I pick the more aggressive control law. I take a step in that direction. It actually was about as effective as I thought it would be. So maybe my model's getting better. Maybe my control is getting more effective. And then you repeat and you repeat and you repeat. And that's the whole process. So you use a model to make a really fast decision based on a forecast. You optimize over all of the control decisions you could take. You optimize based on your model what you think is going to get you the best outcome given kind of your control authority. And then you actually enact those controls and see what happens. If your model's not that good, you need to measure the system and correct and correct and correct. And so you keep going and going and going. And eventually you can do a pretty good job of stabilizing even really, really nasty complex systems. Okay, and eventually maybe you can even turn the control off. That's like the goal that we would all like to do, is turn the control off. Okay. So I just want to point out that model predictive control is a really, really useful framework to start understanding how do you balance imperfect measurements, imperfect models, and imperfect control laws to make robust, high performance, and agile corrections to your system. So I love model predictive control, and I think it's actually kind of encouraging. If you look at what policymakers have done, it actually follows that MPC paradigm pretty well. We have imperfect models, imperfect forecasts. They make decisions, they see what happens, they make more decisions, and that's almost exactly what policymakers are doing. So we need better models, and we need to be clear about what our objective functions are, and it would help if we were doing an actual control optimization and actual forecasts. So I'm advocating for bringing controls specialists on board these teams, along with medical doctors and policymakers. I think we need people who think about systems and control. Okay, so I want to talk about robustness. Robustness is a huge challenge when you have time delays. So one of my absolute favorite papers in control theory is this 1978 paper by John Doyle, Guaranteed Margins for LQG Regulators. What that basically is saying is, do we have guaranteed robustness for a certain type of optimal controller? Abstract, there are none. Meaning, in general, this type of optimal controller where you're using sensor measurements can be arbitrarily fragile and not robust. And this paper, when it came out, this is less than one printed page. He basically shows a counterexample. Turned the field of optimal control on its head and got everybody thinking about robustness. And so you're not just trying to optimize, you're also trying to optimize and make your system robust at the same time. And this is something that we find a lot in optimization in general, is that if you have a constrained optimization problem, often you'll optimize yourself right up to this knife's edge of performance where you have killer performance, but if anything goes wrong, you fall off a cliff. And that's what we want to avoid in these control systems. We don't want to just optimize ourselves off a cliff. We want to optimize taking into consideration that we also want our system to be robust to uncertainty and to things going wrong and to our model not being perfect. And so John Doyle and others for the decades that followed essentially invented this field of robust control that kind of gets the best of both worlds. You can have high performance systems and make them robust. And I think, again, this is just critical for people to understand what are the fundamental limits on robust performance with feedback, with measurements, if you have time delays, things like that. And this has actually gone into real practice. So, the design of the internet is a robust control system. So, lots of our systems in daily life right now, supply chains and the internet and other systems are designed to be robust. Now, could they be more robust? Probably. Supply chains are optimized for performance, but you would want to optimize your supply chain to also be robust to failures. Okay, so if you have a system that's not robust, oftentimes what that means is that when you enact your control, it's so, you're pushing the performance limit so much that the system might become unstable if anything changes. And so instability, I like to think about, kind of that microphone speaker feedback where you hear kind of that growing loud noise get louder and louder and louder because you're getting this unstable feedback loop in the audio system. This also comes up in flight dynamics. So when pilots are trying to control these really slow instabilities in the airplane, essentially they can often kick the system in the wrong direction because they're kicking at the wrong time and make the oscillation worse. This is called a Fugate oscillation. And one of the points I really want to make in this lecture is that time delays in your system, in your measurements, in your controller, in any part of your system, limit your robust performance and can cause instability. And so that's something we need to be really cognizant of in the COVID-19 control system, is that we have time delays. And so, because of this incubation period, because of the time delays in the measurements and the time delays in action, we have fundamental limits on robust performance with feedback. And we just have to keep that in mind. We have to understand that mathematically, what that means. Okay, so robustness has huge implications in this system because of the time delay aspect. Now, another aspect I want to talk about is eradication. So, right now we're talking about flattening the curve, not eradicating COVID-19. We're talking about bringing people back to work, phasing in, work and schools and gatherings and every, daily life. We want to go back to living normal lives again. Now, I want to talk a little bit about just eradication in general, which is a much more aggressive, a much harder control problem, is to actually completely squash it to zero. One effort in eradication that has actually been successful is smallpox. This was a global effort, massive, rollout of smallpox vaccines. Polio also was a huge success story. So, this relied on having a vaccine. So Jonas Salk created, and researchers with him created the polio vaccine, and other researchers created the smallpox vaccine that allowed these large-scale eradication efforts. Okay, and so that's really important, is that to actually suppress this, you essentially need a vaccine, obviously. Okay. We would also like to do this with malaria. That would be really cool, and have a huge positive impact in the world if you could suppress and eventually eradicate malaria. So researchers at the Institute for Disease Modeling are thinking a lot about how do you model these disease systems? How do you control these disease systems with different intervention strategies? How do you suppress these disease systems with global surveillance networks, with global intervention networks? They're doing awesome work. This is largely funded by the Gates Foundation, and they're focusing eventually on malaria, but they're talking also about polio. So even though polio is eradicated in the US, and in lots of the Western world, there are still pockets of polio out there in the world, in Nigeria, in Pakistan. There's a few pockets of polio. Now, polio is really hard. Eradication is essentially trying to stabilize an extremely high-dimensional unstable system. One infection can grow unstable in one person. So you have billions of people on Earth. Any one of them can be a point of instability. So, instability is like trying to stabilize a broom in its upright position on your hand. That's hard enough with 1 degree of freedom. If you have billions of degrees of freedom for every human, it's a much, much harder problem to stabilize and to eventually squash these disease systems. Now, essentially, I always think about this as a whack-a-mole problem, but it's even worse than a whack-a-mole problem. It's a time-delayed whack-a-mole problem, where what you see and what is actually happening are delayed in time. Okay, so it's really, really hard control problem to try to squash all of these points of instability. And what's even worse in the case of polio, there's a limited observation rate. You actually can't, I think it's something like 1 in every 200 cases actually exhibits symptoms. So you might have a low level of polio in a population and only occasionally do you observe it. That makes this eradication problem especially difficult. So it's even worse than time delay whack-a-mole. It's time delay whack-a-mole wearing a blindfold, because you only see 1 out of every 100 or 200 cases show symptoms. And that's not so different from COVID-19. It's not quite as extreme, but there are tons of asymptomatic carriers and asymptomatic infections, and that makes this really, really, really hard from a control standpoint. So to actually do a good job, you would eventually need a lot of people are talking about contact tracing, so finding individuals who are sick and figuring out who they have been in contact with. This is being deployed in East Asia and other places, really like boots on the ground networks of surveillance trying to figure out where this is spreading, because the observations are so difficult to make, okay? And actually, that's something I'm going to talk about also, is just what are the sensing strategies to make these controllers more effective, to make our models more effective. We need lots of aggressive sensor networks and information to inform these control laws. Okay, so some of the moral of this is that control at its heart is an optimization problem, a constrained optimization problem. There's a lot of real-world constraints here. We're going to use our models, we're going to use our measurements. We have to respect the fact that they are both imperfect, but that's exactly what control theory is designed to handle. Okay, so I hope you found this useful. Yeah, thank you.